Yes.
Excellent. Thank you so much, everyone, for joining us today. And my name is David Brown, the small ruminant specialist with University of Missouri Extension. I want to welcome everyone to University of Missouri Extension Sheep and Goat monthly webinar series. And before we go ahead today, just a few announcements before we start. Um, Please know that the webinar is being recorded and this is going to be made available to everyone. We're going to post these on MU Smallmanand YouTube channel, so you can please take some time to watch all over again in case you miss out any of the information that'll be provided today. And also, we're going to send the PDF version of today's presentation to everyone, as a follow up, to help us understand better things that will be discussed today. Please type your questions in the chat box as we progress. We're going to make sure that we take some time to address all the questions. That will be at the end of the presentation. Dr. Dennis will take some questions at the end of our presentation. So please, in case you have any question, feel free to type in the questions in the chat box, and that'll be monitored as we go on today. Um, I think one more thing, we're gonna be having our next webinar in August due to the upcoming Sheep and Goats Fields Day in July, and I think Debbie will help us to put the information later on in the chat box. Also, please feel free to complete our evaluation survey that'll be posted in the chat box as we go on during the webinar session today. Without wasting much time, today's webinar is titled Managing Lambing and Kidney Complications. I've been getting calls, on how to register, and we want to appreciate Dr. Dennis for our time today. Um, the guest speaker is Dr. Dennis Kanachi. I believe I got the pronunciation well, from Idaho. Pardon me for that. She's a small ruminant medicine specialist with the University of Idaho, and she's going to be talking today, like I said, on managing lambing and kidney complication. Dr. Dennis, over to you. Thank you so much.
Thank you, David, and welcome everybody. Yeah, I'm really happy to be able to talk with you today. One of my jobs here at the university is, teaching undergrad. So I teach the sheep production as well as advanced livestock reproduction and animal disease management. And I also work with the senior vet students from Washington State University. They come over and spend a couple weeks with us throughout the year doing a lot of lambing and sheep medicine, et cetera. So this is, certainly in my wheelhouse, and we'll go ahead and get started. Okay. If we can get it. There we go. Okay, so on the objectives of what we'll talk about, prepartum problems, parturition, and then the newborn kid lamb management, and postpartum doe and ewe management. So when we talk about disorders of pregnancy, probably the most common one that we're going to be faced with is pregnancy toxemia. Some people talk about it as ketosis. The pathophysiology is the same. Basically, it's a situation where the ewe or the doe is unable to consume enough energy, either because of poor quality nutrition, or in some cases, it's just a physical situation, because there's just a multitude of fetuses in her abdomen, and that reduces the size of the rumen, as being shown here on this picture. We typically are going to see this during that last month of pregnancy. So this is when the youngsters are at the largest and requiring most amount of energy from the ewe. We can see it in ewes that are very thin, as well as ewes and does that are very fat. And oftentimes too, we're going to see that with the ewes or does that have multiple. So the more they have in there, the more likely they are to develop this. Clinical signs. So to me, the first thing that I'll usually see is at the time of feeding, these guys don't get up and make it to the feed bunk. And that's going to be my first clue that something's going on with them. And we'll want to deal with them. So they are often recumbent, difficult for them to get up. They may look a little depressed. they may actually be uncomfortable, teeth grinding, or that bruxism. And in some cases, we can actually see neurological signs. Again, this is a lack of glucose. So without glucose, we can see, multiple clinical signs, neurological signs associated with that. So this is a doe that we would hope we would pick this up before she gets to, this point. But in some cases, they can look fine in the morning, and then you go back to check on them, and they're like this. So this is definitely a animal that would need some intervention. So what to do when you suspect that this is going on with your your doe? So the first thing is we hope that we've dealt with the nutritional part of it, that we have them on a good plane of nutrition. They, at this point, again, they can't take in a lot of volume. So we're going to, whereas they need their forages for sure, we do also need to be adding some type of a concentrate. They're getting a little more bang for the bite, if you will, when they consume that. So then the next step, even on that good nutritional aspect, we're still going to see this occur. And so the first thing I'm going to do for them is give them some propylene glycol. So when they consume propylene glycol, they take it in orally. Then it does have to be biotransformed through the liver, and then it develops precursors to glucose, which then the animal can put together to help support those glucose needs. So I did mention it has to go through the liver. So if we're dealing with an animal that we suspect there's some liver issues with, we don't want to go with propylene glycol, but just go right to the oral dextrose. And again, if you want to go with oral dextrose, that's fine. Just beware that especially if you're monitoring these animals using something like a glucose monitor, we can start to get kind of funny readings when we've been supporting them with dextrose. CMPK that I have up there, so that's calcium, magnesium, phosphorus, and potassium. So again, remember that these gals can suffer from low calcium as well, because of if they have a number of fetuses in there. So potentially what we're seeing may have some low calcium associated with it. So I often will put that in the mixes as well. I have the box of red wine up there. This was a question that was asked of me when I gave a similar webinar back in December, and I had never heard of the red wine treatment. And so doing some investigating into it, apparently giving the red wine to our ruminants will act similarly to how propylene glycol does. There is some evidence that it takes quite a bit of this to get them turned around. I have no experience with it, and again, it's not something that I'm going to institute at the university, but it may be something that you've heard about. And again, my preference would just be go right with the propylene glycol. We do need to monitor these gals. So, we give the propylene glycol, we would expect them to hopefully get up and, get to the feed bunk. But again, if they're not wanting to, put some feed and water in front of them where they're at. Sometimes all they need is a good drink of water, some food to eat, and then along with the propylene glycol, that will help them to get up and get going. Again, if they continue to have issues, then we may need to go further in with some other additional treatments. But again, monitoring here, I just wanted to go over, there are quite a few different types of monitoring systems out there. This particular one, I like it because it will do both glucose and ketones. So again, the more important thing I feel is glucose. So any glucose monitor out there will work fine if you want to monitor the glucose levels. The ketones, again, ketones increasing, glucose will decrease. Let's see, moving on here. But again, as I mentioned, prevention is really the key to this. So again, you've got to get some good nutrition going. Make sure at this point we're reducing, whatever stresses might potentially be affecting them. This should be a pretty, easy, quiet time for them. Hopefully we've dealt with and are strategically dealing with parasite situations. Some owners will, or some producers will prefer to shear their ewes just because getting rid of that wool weight can be helpful. Also, it may stimulate more dry matter intake. We're too cold here in the winter time, so we don't typically do that. We usually are shearing our ewes late, early fall, so they're not carrying a heavy amount. Again, you can be monitoring these, the beta hydroxybutyrate or the BHB. That is one of the ketones. If that's starting to climb, that's an indication that they're in negative energy balance. Again, looking at glucose, anytime they start to drop below the 50 mg per deciliter is an indication they're low in glucose. But again, if you've been supplementing oral glucose, you could potentially see very high levels of glucose. And so it makes monitoring a little bit more difficult. And we really need to, look at clinical presentation. Management practices. And so I want to kind of go over something that happened to us here at the Sheep Center at the University of Idaho, because again, you can go do things, your management practices, year after year after year and not really get to thinking about it. And then suddenly you have a little bit of an issue. So a couple years back, we had a group of our whiteface ewes that were due to start lambing around January 4th. About right after Christmas, we started getting this, daily occurrence of down ewes. Most of them were, responded very well to the propylene glycol or the oral electrolytes such as the Resorb. And again, remember, Resorb has that dextrose in it. So that's really more what they were responding to. We had 2 that delivered stillborn lambs, and otherwise the rest of them we managed to get through normal parturition, and everything seemed to be okay. But so historically what we've done, so this is our lambing area here, our drop pens, but we would keep the ewes out in these larger areas, and then the feed truck could then just drop the feed to them, and then they had the access then to move up into the drop pens. So then, going further into mid-January into February, when our Suffolk group were starting to lamb, we ended up having much more serious issues. We rarely have to do C-sections, but we, in a short period of time, had 5 ewes that, tore his uterus. And so this can be a sequela to the lack of energy, because that uterus becomes flaccid, can flip around on itself. And so, it's requiring these C-sections. And so, I was kind of just racking my brain, what was going on. And one day I happened to, so this is the pen where typically the ewes would be housed. So they have an area here with straw that they can lay down in, and then the feed bunks are over here. Well, this particular year, it was much warmer than it generally had been. And so we ended up with a lot of wet and mud. Anyway, one day when I was out there, when the feed truck was coming through, most of the ewes got up, headed to the feed bunk, which is what I would expect. But there were a few of them that they got up and they started coming out, and they just sort of looked at this, and you could just see them give a heavy sigh, and they just turned around and went back and laid back down. So, light bulb went off to me that, this was more than they could handle. We had to change that environment. So we changed out, and we moved everybody up into this area, got rid of all the superfluous animals that were in here, and made this all just for drop boxes, and brought the ewes all up in here. Then they could be fed right here. And the situation was no longer an issue, and it has continued to not be an issue for us, going forward. And so again, it's just kind of an example of, paying attention to that environment when, things, pop up that you can't quite put your finger on what's going on. Okay, so some other things that we can see late-term pregnancy is this rupture of the prepubic tendon. So this is a tendon that tends to run along from stem to stern, so from the pubis to the respiratory rib cage. And so typically when this ruptures, this is a picture of this in a goat. And so this is what it can look like, because now all of a sudden we have no abdominal muscle there. And so typically we're going to see this in older animals that have had multiple pregnancies already. We may see this in the situation with fetal hydrops, and this is where we have an excessive amount of fluid that builds up in that uterus, and it's a problem with the fetus. But again, it's just a large amount of fluid, causes too much pressure. We also, secondary to something like abdominal trauma, I've seen this occur in a couple of views that we've had that had hernias. And so as they went farther along in gestation, then this happens. So typically when this does occur, they're not going to be able to have a normal pregnancy or normal parturition, because they can't push. They have no abdominal push. So go ahead and induce parturition, but be planning for a C-section. And then, if that is all successful and the owner still wants to keep this animal around, make it into a pet. You can do some repair, put some meshes in there. Along the same line are hernias. And we've had a couple of pretty large hernias develop in our ewes. And I just kind of watch them, because in both cases, they've been able to do fine. They normal parturition, but I'm prepared to do C-sections on them if they end up having difficulties. Vaginal prolapse. So this is associated with usually it's going to be, it's related to hormones. So in not all animals, but some animals will respond to the hormonal changes that are occurring by having excess tissue develop within that vaginal canal. And then as they get closer to parturition, again, abdominal fill, numerous fetuses, maybe they're being fed, too much roughage. So there's a lot of bulk in that rumen. Again, coughing, secondary to dusty environments, that's putting, pressure on there. And so then you get this, this vaginal tissue that's poking out of there. Again, I tend to be, fairly conservative with these guys. This is a harness that you can put on them that will help, that holds things in there. And they're supposed to be able to, lamb through that. I don't believe that. So, if we decide to put that on them, we'll watch them real closely and pull them off just prior to parturition. Sometimes it can affect their ability to urinate. So they do need to be monitored. And again, it is hormone related, but generally I find if they have it occur one time, they are probably going to have it occur, for the next breeding. So I'll consider to either cull them or make them into a pet. Abortion situations. So these are something that you do need to pay attention to. I have some of the more common causes of abortion listed there. So some of these are, bacterial cause, toxoplasmosis, and then there's non-infectious types of things that can cause abortions to occur as well. For me, the most important thing is to one, be able to recognize that, and sometimes easier said than done. In the late term abortions, you typically will find the fetus, hopefully placenta, and then vaginal discharge around the dam. Plus minus whether the dam will be thick, it just kind of depends on what the underlying cause of it is. If it's earlier in pregnancy, you may find the fetus, but it may be more difficult to identify which dam is associated with the fetus that you found. I still feel like it's reasonable to deal or to go ahead and have these abortions looked at. And just because, if it's something that's contagious, if you get on top of it right away, you hopefully can stop an abortion storm, or again, understanding things like, chlamydia, you may not see an abortion storm this year, but the following year you will. So, again, being able to identify what the source or cause of the abortion is will gain you a lot of knowledge. And again, not knowing that it's not these things or not that can also be a wealth of knowledge as well. So when you find these things, again, make sure you've got your gloves on, because this is the time also when zoonotic issues, Campylobacter is zoonotic, and some other Brucella in our does is a zoonotic, Q fever. So there are quite a few things out there that you don't want to get infected with. So wear your gloves, package up the fetus, the placenta, and then ideally a serum sample from the dam, and then send it to your laboratory and have them assess this. And again, they will be able to tell you a lot of what is or isn't wrong. If there isn't any infectious, then we may want to start looking at some nutritional possibilities associated with abortion. So I really feel it's a money well spent to check these things out. Okay, so moving on to parturition. So again, this is, list of supplies that everyone should have on hand prior to parturition commencing in your production system. Again, it's not, complete. You may have certain things that depending on your situation, you want to have on hand. Other things, colostrum. So it's always a good idea to have some banked colostrum in your freezer. It's fairly easy during your normal time of lambing or kidding, when it is available, to bank some of the colostrum from ewes or does that maybe have a single. So you can certainly bank colostrum, maybe even a couple bags of it. I'll try to get we'll usually put it in about 6 ounce of those freezer bags, put them in the freezer, and then have them available. Always remember too to put the date on them. Generally, the recommendation is that the quality of the colostrum will stay pretty good for a year. I don't tend to throw any colostrum out just in a pinch. I will have it available, but we tend to, because of the number of animals we're lambing out, we tend to use up whatever our stores are, and then repeat or replenish as the system, or as parturition continues for that season. Mineral oil, fleet enemas. Though I have used fleet enemas in both lambs and kids, and they've worked pretty well. Though typically the bigger issue usually is going to be diarrhea issues. And again, especially if you've got good moms that are producing good quality colostrum and milk, the diarrhea stuff is going to be there. It's going to happen, and it typically will have that yellow color to it, not be particularly stinky or anything. And if it seems excessive, you can use a little bit of Pepto in them. Remember, if you do, it is going to change that stool to a dark color. So you may now think that they have a bleeding issue, but it's really the Pepto-Bismol. The other thing I would say more about the diarrhea is that a lot of times it can lead to these, pasty vents where they have a lot of dried stool over their rectums, and that can make it problematic for them to defecate. So be sure that you're cleaning that up on some of these that are have a real issue there. Other supplies, again, elastrator bands, ear tags, the things like that, depending on how you're processing your youngsters. Snares. So I don't recommend chains for utilizing for if we need to pull or lambs. I do like this snare here. This can get around head and leg. Oftentimes I'm just using it to get it around the head to kind of position a head that's out of place. These are nice for getting around the legs. They're soft, they're pliable. In a pinch, baling twine works really well as for me, and I probably use that more than anything. And then a rectal temperature. You want to have a thermometer, a good working thermometer, because you will want to be assessing these youngsters, and rectal temperature is going to be a great way to assess them. So the signs of impending birth. So typically about 10 days prior to parturition, see that relaxation of the the pelvic ligament. So the tail head will stick up. This will kind of look a little sunken. Easier to spot in our goats. Not so easy to spot in a lot of our ewes. Typically, mammary development tends to be more what we're going after. First stage of labor, so they'll tend to be restless, up and down. Maybe doing a little bit of nesting behavior. So at this time, not a lot is being seen out here, but inside here, those youngsters are hopefully positioning themselves correctly to be, born in the proper position. This here is evidence of just the mucus plug. Sometimes you'll see that. A lot of times what we first noticed is just a bag that's dropping out that's full of fluid. So then the second stage of labor is when they go into these strong abdominal contractions. Water bag breaks again. You may see that, you may not, especially with animals that have multiples. It's just not as noticeable. And then, we expect to see them doing some pretty hard abdominal presses, and then would expect the lambs or kids to be born, within 30 to maybe a few hours, depending. And then the third stage of labor, which a lot of people forget about, but that's when we need that afterbirth path. So typically it's going to come right out with each fetus, or right after the last fetus. So hopefully it's afterbirth and we don't see the uterus. But again, that needs to be passed within 8 hours of parturition. So when I put this in here, because again, if you're there assisting at this point, so this animal is out and should and could start breathing on its own. But remember, those fetal membranes can sometimes be a little bit strong, and especially if she's maybe a little bit weak and stressed, she might lay there for a little bit. And so this youngster's trying to breathe but can't because that membrane's there. So, quietly step in, take that off if you feel like it, and you want to just gently pull this youngster out. I would do so, and then go forward. So difficult births. So when to intervene. So what my expectation is after I feel like they've moved into stage 2, and I'm starting to see, evidence of the feet poking out here, I'm going to check on them every 20 minutes, and I want to see some progression. And if I'm not seeing much progression, then I'm going to, gently go up there and just kind of grab a hold and kind of gently pull and see if things are as they should be. I mean, you look at this picture here, and we have supposedly one front leg, but this one's back, so we probably have an elbow stuck over the pelvis. But you could possibly just gently pull that, and it would just pop out, and then hopefully there should be a little nose here. If this could also be one coming backwards, that they're just a little bit on their side, and so that's why we see the presentation this way. But again, you're going to get in there, you're going to kind of assess some things just to determine whether things are progressing as they should, or if you need need to intervene a little bit more. I have these couple of speculums up here. So this is actually one designed for sheep and goats, and it has a light associated with it. So especially if you feel like they've gone into stage 2, they're doing some heavy abdominal pressing, and you're just not seeing anything back here, you can take these speculums, peek in there, take a look at that cervix, and make sure it's actually dilated. If it's not, you can try to manually dilate it. If that's not working, then you may need to consider C-section. Again, in preparation for possible intervention, there's some things you should have at the ready. Again, always plenty of lubricant. You want to keep things as clean as possible. This is not a sterile procedure by any stretch, but we can, try to keep things as clean as possible. Your gloves, snares, whatever those are going to be, then clean towels, etc., for potential more deeper intervention. So again, these are some of the positions that we can see. Again, one of the challenges with our small ruminants is the fact that they do tend to have multiples. So it's not, I would say this is probably the most common issue that I see is these forelegs coming out. And so you need to get in there and determine which legs belong to which fetus and push one back and get the other out. One thing I will say about this picture here is that oftentimes when you see a head back, it's not always, but it can be an indication that this fetus here may be dead. When they do die in utero, then that head and neck do become very flaccid, and it's very easy for it to just flop backwards. So if I get in there and I feel that, my tendency is just going to be to push this one back, go after the one that's coming normal, and then come and get this one, just because you don't want to, run the risk of trying to get this one out when it may not be alive, and then, run the chance of this one suffocating. So again, others, depending on your skill level, are certainly ones that you could, potentially handle yourself. If not, then, certainly seek out veterinary help there. So again, some of the rules for intervention, again, we want to try to be as clean as possible. Make sure, you're wearing your gloves, clean the area as much as you can. Trim nails. This is not a time to have long nails. You're going to cause a lot of damage. And then again, remember to wear your gloves. We need to be gentle, but again, we also need to be efficient. And this is probably the hardest thing to learn, is how much pull we need. And again, that's the hard thing to teach. It's a feel thing, and experience really gives you the best or the best experience there. Again, one of the reasons I say don't use chains, because they can be, pretty damaging to these neonates. So, something that's softer, or the baling twine. And again, know your limitations. Know when to call a veterinarian, and on that same note, make sure that you have a veterinarian that you can call that's going to be able to help you, that has experience in small ruminant birthing, and is on call there to come. And because again, one of the things that is difficult is if things are really going poorly, these guys are going to be in a lot of pain and discomfort. And I can get out there, I can sedate them, I can anesthetize them, I can give them medication to make this better for them. And again, if that's not the, most producers don't have that option. So if you choose to not use a veterinarian, or just don't have one available, you may need to have a plan of being able to, euthanize these gals if things have just really gone downhill, because it can be, a very painful situation if you don't have a way of intervening on some of that discomfort. So initial postpartum care. So the biggest thing is make sure that they're breathing. So get those tissues away from the nose and mouth, clearing the nostrils and mouth, stimulating, rubbing the chest and body vigorously will definitely help to stimulate them. If there's a lot of gurgling going on, and you don't happen to have one of these resuscitators in your back pocket, I will oftentimes just lift the back end of the neonate to let gravity help kind of clear those lungs, as well as taking a little, turkey baster or ear flusher sucker thing and help to, push things out of or pull things out of the respiratory tract. Check for suckling reflex. Hopefully mom is up and interested in what's going on. If not, if she's seeming a little bit sluggish or a little bit quivery, you can give her a molasses drench or a dose of dextrose. And then, just kind of checking on things, making sure that the that things that mom is getting up, cleaning them up, and then that baby is getting up and nursing, etc. Yeah, this thing here is kind of a neat little resuscitator. Part of it is a suction deal, so you can put it over their nose and mouth, and that'll help to suck stuff out of the nose and mouth. And then the other will actually help them breathe a little bit if they're needing some of that. So this can be a nice thing to have in your toolbox. And then we want to, clip and dip that navel and then strip those teeth. Remember those teeth, because of the colostrum, they're going to have a little waxy end to them. And so we want to get that out of there so that the kid or lamb isn't working overtime trying to get that colostrum out of there. So as far as the length of the navel, I'm not going to worry too much about it unless I think they're going to step on it or mom's going to step on it. If it's long, then I'll put a hemostat on there, cut it off. If it bleeds, I'll put a little ligature on there. Most of the time they won't. And then of course, your iodine or Chlorohex or whatever you have on hand to dip those navels. But very important that those navels get treated. So the postpartum care on the doe and ewe. So we definitely want to make sure that we have taken care of any additional fetuses. That's always one of the things with the vet students is that they seem to be a little bit reluctant to get in there and check, but sometimes that's just what you have to do. Make sure there isn't anything else in there. And then also, again, if there's, if they seem a little quivery, it could be, the ketosis situation. It also could be low calcium. So I'll usually give them a drench of the CMPK as well as dextrose. Palpate that udder, look at the colostrum, make sure it looks good and it's not that nice yellow sticky looking stuff. If you're seeing anything that looks red or clotty or nasty, then you're going to need to, institute some care for the neonate. Again, if you have the option at this time, it's a good time to go ahead and bank some colostrum if it's appropriate. Again, monitoring for appropriate maternal responses. And then, the first 72 hours are really a time when we should be closely monitoring both the ewe and the newborn. Again, in our sheep operations, we tend to have the jug set up for them. And this is so we'll let them drop in the drop pens, and then we'll move them right into the jug. And this is a good opportunity for mom and babies to get to know each other, as well as be able to assess mom and babies. Mom's producing milk and eating and drinking. Babies are getting up and nursing and thriving. So again, just a good bedding, dry, protected from the elements, and in some place that's easy for you to monitor them. So this is just a little recipe, if you will, for feeding lambs and kids. So it kind of gives you an idea of what kind of volume of I have milk, but colostrum / milk that they should be getting in that first 24 hours. Remember, basically, colostrum is important those first 12 hours. So, after that, most of the milk is going to start changing over from colostrum to milk. And so, the amount of immunoglobulins is going to greatly reduce. So very important that, especially that first 12 hours, that we're getting adequate colostrum into these youngsters. So, there's a little bit of math that you can do to figure out exactly, how much they need, and then divide that into, 6 feedings. And so that can give you an idea of what they should be consuming, especially if you're dealing with a youngster that's not eating well, or for some reason, a ewe or a doe that's not producing good colostrum. Check belly fill. So this is, when you pick up the lamb or the kid and just press on the belly, and it should feel like there is something in there. And if it's feeling pretty empty, that's a good indication that they are not nursing. I've seen plenty of lambs get up there and they're latched onto that nipple and they're sucking and their little tails are going, but for whatever reason, nothing is coming out. And so whether it's their poor suckle response or something's going on with the bag, still check that belly fill. Don't just assume that they are actually consuming something because it looks like they are. One of the ways of being able to collect and bank some colostrum, so we've got that that easy milker there. So we have some of those out at the Sheep Center. They work really well. They have different sizes to fit different size nipples. And so that can be nice, ergonomically good on your hands and wrists. Another thing that I've used plenty of times is just to take a 60 cc syringe, pull out the plunger, cut off the end where the needle goes, and then put the plunger in basically backwards. And then this, the end of the syringe would go up against the nipple, and then you can just basically suck out, you know, colostrum or milk, and then put it into whatever it is you're going to store. And so this can work really, really slick for banking and collecting, you know, milk or colostrum. Okay, so, you know, dealing with the hypothermic or hypoglycemic lambs or kids. So typically these things are going to, you know, go hand in hand. So if they are, you know, hypothermic, low body temperature, it's generally going to be because they are low in glucose. So, you know, assessing these guys, as I mentioned before, you know, having that thermometer. So you can take the rectal temperatures of these guys. So you see what looks like a weak, depressed stomach is empty, but even just a weak, depressed lamb or kid, you know, take its temperature. I rarely will take glucose levels just because it's, you know, it's just too much messing around. When these guys are low temp like this, they need to be dealt with, and they need to be dealt with quickly because they can succumb to this hypothermia pretty darn fast. So this here slide is just kind of walking you through, you know, how how I treat these hypothermic lambs and kids. So generally the first thing a lot of people notice is they're depressed, that they're not getting up to nurse. Take their temperature. If their temp is between 100 and 101, then I will just warm up some milk or colostrum, depending on how old they are. And then I will try to get them to take it by the bottle. Again, we don't want them to lose that suckle reflex. If we do too much tubing in these youngsters, that is a possibility. But if they're not going to suckle on the bottle, then I'm going to pass that feeding tube and get that warm milk or colostrum into them. I will usually leave them with mom. We have a place like a corner in the jugs that we can block the lambs from the moms, and we can put a heat lamp in there. And so that can keep the lambs a little bit warmer than the moms. And so that works pretty well, but you got to check on them, retake those temperatures, make sure that temp's going the right way, not the wrong way. If the temp is below 100 and they are depressed, you know, do this thing as similar above, but I'm going to warm them up. And then if their temp is, you know, below 100 degrees Fahrenheit, and then they're comatose. So, you know, there's no swallow reflex. They're kind of checking out. This is where I'm going to mix up that 50% dextrose and give that to them intraperitoneal, and then put them into the warming box. And I'm going to look at these guys every 30 minutes, retake their temperature, reassess them, you know, give them more dextrose. Once they get a swallow, then I'll go ahead and tube them. I do not tube them if there's no swallow response, because it's too easy for those the lambing tubes to get into the lungs. So I'll just continue to support them until they have a swallow, then go ahead and tube them, and then hopefully they'll continue to thrive. And once their temp has leveled out, then they can go in with mom. One thing here I want to say, do not put them in a warming box or a bucket of warm water unless you have administered an energy source. Remember, these guys are like this because they are lacking energy. If you try to warm them up, they have no reserve to warm up with, so it will cause them to go into seizures. So got to have an energy source first, then put them in a warming box. Or the other thing I'll do is, as a 5-gallon bucket of warm water, put them in a garbage sack, just tie it around their neck, and then put them in that bucket of warm water. And again, monitoring them until things turn around and they're able to go back to mom. So this is that injection of intraperitoneal dextrose mixed with sterile water. So your guide where you're going to stick that umbilical cord here. So depending on the size of the lamb, I'm going to go about, if it's a bigger lamb, I'll go about 1 inch down and 1 inch to one side or the other. I'm going to use just a 12 gauge 1 inch needle and give that injection. If it's a smaller lamb, I'll maybe just go like a 1/2 inch side to side. This reference down here shows and talks about these intraperitoneal injections. So it's a really good resource for you. Okay, so back to other postpartum disorders. So we'll quickly go through these, and some of them we've actually already kind of touched on, because the pregnancy toxemia, again, pre and postpartum issues. So uterine prolapses, typically these are going to occur right after that last lamb or kid is born, that you or doe gives a final little push, and what has happened is during the process, one of those uterine horns kind of inverted within itself, and so now we have this big mass of stuff in that pelvic canal, and so she presses, and then it just pops on out of there. This is an emergency. In most cases, you're going to need a veterinarian come in, do epidurals, get that put back in for you. These animals usually are not ones you're going to want to keep in your breeding operation. Again, maybe can be become a pet. Again, retained placentas, we talked a little bit about these. Again, these are pretty rare in our small ruminants. If you're having issues with this, definitely want to be checking some of your mineral, selenium, this type of minerals and micro, macro, and even some of your vitamins. Typically dystocias or anything that may have caused infection, like abortions, things like that, we can see retained placentas. So treatment, basically, we're going to we utilize oxytocin to kind of stimulate that uterus to involute and hopefully kick that placenta out. We do know in the case of the ewe, her cervix is, and when it tightens down, is much more tortuous than the doe. And so it's easy for this to get kind of caught up in that cervix. Through some research that we've done, and it's out in the literature as well, you can give these higher doses of oxytocin. And again, some vets might kind of cringe at that a little bit, but I've used this. I've used actually the 10 cc. I find it works much better than the lower dose, and it will actually after 20 minutes allow for some cervical relaxation. And I've had a really good luck with then getting those placentas to pop out of there. Do not pull on them. Let them come out naturally. We can do more damage pulling on them than just just letting kind of nature take its course. Again, if she is doing any pressing or whatever, I will hold off on the oxytocin because I don't want to create a uterine prolapse. Again, these typically you can add weight to these, and that will help them come out as well. And again, if you're having more issues with these than you've had in the past, be checking on some of your minerals and vitamins. Metritis or endometritis. So this is associated with infection within the lining of the uterus itself. These things can be a little sneaky. We tend to see them more associated with, if there is retained fetal membranes, retained placenta, I will just assume that they have some level of metritis, and I'm going to treat them such. Certainly can see it after dystocias or dead fetuses or fetal mummies, etc., or abortions. Typically, they're going to be producing kind of a discharge. Usually it doesn't smell very good. But remember, that animals will normally produce this lochia up to about 12 weeks after parturition. This is actually lochia on the hind leg of a goat. And this is what it'll look like. And the difference is it doesn't really have a bad smell to it. But again, we've had a couple of issues with this in the last couple of breeding or parturition seasons. And so I'm a little more inclined to treat sooner than kind of a wait and see, because a lot of these animals that we've had issues with were very normal, saw no issues with them at all, and then all of a sudden they are down, they're sick, and been very difficult to turn around. So I feel like erring a little bit more on the side of caution with these. So typically again, sometimes if you're not sure what's going on, you can actually, scope these animals, take a look. If you're seeing a lot of, discharge or pussy material, I'll usually will treat them with a broad spectrum antibiotic. We know our, Exenel or Naxil, the Ceftiofurs get pretty good levels in our uterine lining, and so I like that pretty well. I will always put them on Banamine. Banamine, one of its things that it will help with is endotoxemia. So plus, swelling, being uncomfortable, make the animal feel better. I don't typically do uterine flushes, but there may be situations that I might consider that. Again, in our sheep and the cervix issue, it makes it difficult to really do much with the uterine flushes. The hormones, so the prostaglandin, sometimes there's a corpus luteum that's sitting on that one or both ovaries that's causing some of the issue here. We can give them prostaglandin, get rid of that. That will cycle them around, bring them into that part of their where they're producing more estrogen, which will bring more white blood cells and blood to that uterus and just help the body clean itself. And of course, oxytocin can help to involute that uterus and help clean things out as well. Hopefully they are up to date on in their clostridial vaccines. This is something that should have been dealt with, way before, parturition occurred, because this is a time when you could potentially get some issues associated with that. Pyometra, so this is basically a pus-filled uterus. These generally don't show up right after parturition. They typically are going to show up a little bit later. So our small ruminants are going into anestrus. They're under the influence of prostaglandin or progesterone, and so that can lead to a uterus that just starts filling up with pus. Sometimes they will have this discharge associated with them, and sometimes that the discharge is more inspissated, kind of cottage cheese-like, and so they're not discharging as much, and so you pick it up on an ultrasound. And then sometimes you pick it up the next breeding season because she's failed to settle or to even be marked by the ram or buck. So depending on the situation, again, hormones can be helpful in treating these, but a lot of times it's not very remarkable treatment in these guys, and so they may end up going into the pet category. So the last thing that I'll talk about, we've talked about ketosis, but I just want to touch a little bit on hypocalcemia. Again, we can see this in our, certainly our dairy does and our ewes. Certainly not as common as we see in dairy cattle at all, but we can see it. And also remember, because of the multitude fetuses that they can have, we can see this prepartum as well as postpartum. So some of the muscle signs that you will see are just that, the hyperactive muscle or the twitchy muscle, maybe some ataxia. Pull some blood on them, look at their calcium levels. If they become recumbent, they become comatose, they need treatment, ASAP. And so getting that calcium into them, got a dose up there. But again, depending on how you're going to give it, it's kind of going to depend on how bad they are. If they're, really down, maybe comatose, you want it into them IV, so it's getting to them very quickly. If you're suspecting this might be what's going on with them, then oral prep would be fine. But a good prevention is alfalfa hay. We know it's high in calcium. If for whatever reason that's not part of what you could forage that you can feed your animals, and just making sure that you do have mineral mixes that are dealing with calcium levels. So with that, that is so I can take some questions.
Thank you so much. That was very informative. That was excellent. Thank you. In case you have any question, you may please go ahead and put that in the chat box. But a question came in to me, and I'm going to read it out to you quickly. This person wanted to know how long should stage 2 labor last before I intervene. So if there's no progression to stage 3, how long should this person intervene?
Yeah. So so again, what I would say to that is that if again, so they're in stage 2, so you're actually seeing abdominal pressing, then I want to see some kind of progress within 20 minutes. So if nothing's happening, you're not seeing any feet come out, maybe they quit, doing a press. So this is when you can, glove up and or take your speculum and look in there and see, are you seeing feet? A lot of times, if you just maybe open that vulva and you'll see feet are there, and that's great. You might then go ahead and put some, a snare on both those feet and do some gentle traction. See if you can, get those feet coming. Is there a nose? Because remember that nose should be on there. So yeah, I'm gonna, this is why it's hard to say, well, after, an hour or after 2 hours, because we have seen sheep, because they're prey animals, they can start into stage 1, but something stresses them out. They can actually shut the whole process down and then start up again, 36 hours later. I've seen that happen. So it's not always a continual progression. And that's why you do have to just get in there and evaluate these animals.
Great, thank you, Doctor. I think there's a question in could you explain how to avoid seizure when you are treating hypothermia again?
So again, if you give some type of energy source, so if they're able to swallow and you're comfortable, passing a tube, getting, 4 to 6 ounces of warm milk or colostrum into that belly, and then you have given them an energy source. If they're comatose, then just put it interperitoneally, as the slides explained. And then again, now they have an energy source. Then you put them in the hot box or a bucket of warm water, and now they'll have that source of energy to start relaying on, and that will keep them from developing seizures.
Excellent. I think you mentioned this, but for emphasis, this person wanted to know when should I call a vet during lambing or kidding complication? At what stage?
Yeah. At what? So, yeah, it's always. I'll say when I was out in practice, a lot of owners are worried. My sense of it was call sooner than later. If I am, if I get out there and even if I feel like, this animal would have had this lamb or this kid fine, I'm there, I'm going to go ahead and assist, getting this lamb out, or kid. But yeah, I think sometimes it's a situation where they have gone into stage 2 and for whatever reason, they just weren't observed real well. We use, production systems that happens, more frequently. And so, you kind of find these animals and that they're in distress, things are pretty dried out. And you try to, apply some traction, but the head is back. Yeah, just, just get a hold of your vet and get them out there.
Excellent, thank you. Another question came in. How can I prevent if infections like joint ill? I think it's infectious arthritis. They wanted to know.
Yeah. Okay. So, typically good care of those umbilical cords is the first step. But sometimes you'll still get the navel ill, the joint situations. We've had issues with this in the past. And one of the things that we did do was we did culture what was growing in some of those joints. And so, depending on the situation, if you know what kind of bug is there, then there's some evidence that prophylactic antibiotics may be helpful, but again, not all of your youngsters are going to succumb. So I kind of resist wanting to give everybody a blanket shot of, some kind of an antibiotic. But as soon as I notice that there's maybe a little puffiness in a joint, it's maybe a little bit hot, maybe they're a little lame, then I would get them on treatment.
Great. I think I can take one more question, Dr. Dennis. So after the C-section, like you mentioned, you say such animals could be like used as pet, but
Mm-hmm.
can such animals breed again after they've undergone a C-section? Is it possible for them to breed again?
It is. It is. We have had a couple of very successful C-sections, and that's kind of it. It's sort of like, how did it go? You know, how do you feel that the integrity of the uterus, things like that. And then again, after the surgery, did, the ewe or the doe, did they recover really well? No evidence of infection, this type of thing. So, and then again, there's going to be some scarring in that uterus that's going to occur, but again, if there's not a lot of infection the closure went pretty well, it could be pretty minimal. So the literature will tell you, yes, that they can potentially breed again. So if it's in your goal or your production system to give it a try, there's no reason. I wouldn't say there's not a reason in my mind to not try.
Great. Thank you so much, everyone, for joining today. Thank you to our guest speaker, Dr. Dennis. Thank you for that informative section. Thank you for sending in your questions before we even started the webinar. Please kindly note to fill in the information that's going to be the evaluation. Please, that'll be sent to you alongside with the recording and the PDF version. And also, we have a link to our event information taking place in Missouri. In case you're around, please feel free to join us, and we appreciate you. Of the link of the survey is not working. Okay, we're going to send the link to everyone after today, when we send out the PDF version. Thank you once again, Dr. Dennis. We greatly appreciate your time. And thank you again, everyone, for joining us.
Yeah, you're very welcome. Take care.
Yeah, bye.
Bye-bye.
So, Dr. Dennis, I hope to meet with you when I come over there.
Yep.
Yeah, and possibly look for